Hi, my name is Roxanne Jones, and I'm the Director of Programs for Global Care Force out of Olathe, Kansas. We are an international NGO. Currently, today, I am in a village in central Ukraine where we come every 2 months. This village has a population of about 400 people. My teams come every month to assist the local healthcare providers who basically aren't here or have limited resources to assist their people with their acute and chronic health concerns. Today, this month, I have 4 providers from the United States as well as 2 other professionals from the United States. Our clinics do registration, triage, provider consultation, and then we have, as you can see, our own pharmacy. We carry this in and out every day, every other day, depending where we are. All of our care is free. All of our medications are free. They're shocked that we come back to see them. That's the uniqueness. One unique aspect of Global Care Force is that we return to these villages to follow up with these patients and their chronic healthcare issues, and of course also identify new acute issues. This village has been relatively quiet for the war, but there are still many devastated buildings. There are people who have been displaced that live here. There are many people who left this village and have not returned to this village. Many people are without jobs. Many people are without access to medications because to leave this village, you either must have a car, which is very few, so you walk or ride a bike, or if you're lucky, there is a van called a marshuka that goes to the village maybe 2 or 3 times a week, and you can pay your way and go to the nearest town, which is about 30 minutes away, and get some semblance of health care there. Again, you have to pay for it, and without jobs, it's very difficult to survive. Many of those who are retired might make $70 a month on their pension, they call it. And as Americans know, $70 does not go very far in paying for your chronic health care needs and your medications. This clinic we have here today to my right, you'll see in a few minutes, is very small. It's 3 rooms. 1 room we have triage going. The other 2 rooms, we have 2 doctors in each room. They just work together. They're amazing. Sometimes we have indoor toilets, sometimes we don't. We do have indoor toilets today, which has been very nice. It's also warm enough, as you can see, that we have the pharmacy outside on the ground because the space is so limited inside. We see tons of hypertension, blood sugars that are off the charts. We see a lot of, this time of year, allergies. We're giving tons of pain medication. The lifestyle, even before the war, is hard on the body, the joints. I have a rheumatologist this trip, and he has been giving, I don't know how many injections into the knees, into the shoulders, and the people have been so grateful for the relief of their pain. You can imagine the stress just being aggravated because of the war. Everybody's having difficulty sleeping, anxiety, depression. We have something for everything. It's a general pharmacy. It covers basically everything we see. If we do have a patient that has a need we cannot take care of, we do try to match them to a couple of physicians we have in Kyiv who have many colleagues that are willing to give free care if it's a surgery or some kind of specialized care that patient needs. And we've been very fortunate to refer those patients. We've also been able to purchase some additional medications we don't carry in our pharmacy to assist these people as we can. Certainly we can't always help everybody, but we do the best we can. And thus far, this is our 4th clinic day. We're doing 2 clinics today, and we've already seen over 300 patients. And indeed, we have 6 more days of clinics, and we'll probably exceed the 600 or 700 patient mark, and that will be the most we've ever seen. And this is our 8th medical team. Looking forward to medical teams 9 and 10 this summer, and then a month off for a break for our team and the Ukrainian team. And then we have 4 more teams lined up for the fall. So we would love to have you on one of our teams. We take all types of providers, especially family medicine, emergency, nurses, EMTs, nurse practitioners, nursing assistants, they can do triage for me. Go to our website, globalcareforce.org, and apply. And I look forward to talking to you and having you here in Ukraine.